My name's Jolie Kramer. I'm a clinical nurse specialist here at the Early Episode Psychosis Service at Orchard Avenue Centre. First episode psychosis is when people are experiencing a detachment from reality. So often they may be hearing voices, or they may be seeing things or having perceptual disturbances. They also might be having delusions, so having beliefs in things that are not held by the broader population.
Armadale as a geography is underprivileged and distant from the main Perth CBD. So here in a very small community setting, we have specialist service aiming at providing personalized and recovery-based care for young people and their families experiencing first episode psychosis. A multidisciplinary team focuses on providing specialist services in multiple areas of recovery in a young person's life. The doctors, for example, focus on managing the pharmacological basis predominantly. We have registrars who are training to be future psychiatrists, and they are young as well, so they add that youth vibe to our patients who are our consumers and focus of care. And we have senior staff members who are from social work background, nursing background, and clinical psychology background.
I'm Tom Lamb, I'm a senior social worker. I think actually one of the strengths of the team is in some ways that it is really small. I come from a background of working in adult community care. I worked with a lot of younger people who were experiencing or had diagnoses of a psychotic illness. That was something that I'd identified quite early on that was meaningful work to me. The way in which these teams work, the way in which we work aligns really well with my values. Having a small team, enables really close collaboration. It provides a real sort of personal level of care and personal level of interaction for consumers and their families.
I guess one of the main aims of the early intervention approach is reducing the duration of untreated psychosis. So the longer that someone is presenting with psychotic symptoms, they're more likely to have a more severe course of illness. So if we can identify those people early on and provide them with effective interventions early on, we can really change the trajectory of someone's prognosis. The Metropolitan Health Service, the early episode psychosis team, has really been helpful in reducing readmission rates for young people involved in the program. We do a lot of psychoeducation for our patients and their families, working towards identifying what can be their early warning symptom signs and developing relapse prevention plans.
Because the illnesses that start off the psychosis can be very disabling, and they become dependent on the state and their families. So we try and make them self-sufficient young adults.
I've been working with a young person who had a first episode of psychosis during their Year 12 exams. Very stressful time for them. We've watched her recover and improve, and she's now at university doing her university studies, off medication and maintaining a full complete recovery, and socially engaged and kicking goals.
Excellence for us is the dedicated and committed work that we do as a team. The team for us feels like a family, and the patients that we care for, we see our family members in them. So every young person who achieves remission stays in remission and progresses not just in their mental health journey, but their overall social development, their professional development.
We are innovative, and we have a good program that is backed by research and stands alongside the Australian National Guidelines, which we are constantly working towards to improve our service provision.
That sort of mandate of our team, it enables us to work in an intensive way, in a flexible way, and in a way that meets the individual and their family where they're at. It gives us a long period, potentially up to 3 years, to work with somebody. That sort of flexibility is really unique and quite special. To me, it's the ingredients of producing the most important part of all of this, which is meaningful recovery and the opportunity to get on and live their lives.